So good morning, everyone. Today is Tuesday, July 17th, 2025. I'm Chris Gradnitsky, Eastern Shore Regional Office Professional Development Coordinator for Maryland Department of Health's Developmental Disabilities Administration. We welcome you to the Coordinators of Community Service meeting. If you would like to use closed captioning so you can read what is being said, click this button. Sometimes the transcription is not exact, but it's pretty close. Today's presentation is available in the handout section. Click here where you see the paperclip to download the presentation. All attendees are currently in listen-only mode and your mics and cameras are turned off. This webinar is being recorded and will be uploaded to DDA's CCS YouTube playlist and to the DDA website. Today's PowerPoint will be available for you to download from the materials section. If you are listening by phone, please contact us to have the presentation emailed to you. If you have a question that you would like us to read and answer, click here where you see the question mark to add your questions. And now I'd like to introduce Nicolette Paparadamas, DDA's Director of Coordination of Community Services. Good morning, Nicolette.
Good morning, Chris. Thank you so much. Good morning, everyone. Thanks for joining us today. We are going to be welcoming today Liberty Health to provide an overview of the results of the person-centered improvement activities. We're going to be reviewing, of course, statewide themes and trends to further clarify processes and support the work of CCSs. We'll be talking about comprehensive assessments, Medicaid waiver eligibility, person-centered planning, monitoring, and follow-up. We will also review policy and program updates, including a process to streamline communications and supporting participants who are transitioning out of placement and are forensically involved. We're going to provide an overview of the new participant relocation process and what it means for CCSs and more. And as usual, we're going to wait until the end to address any questions so that we can keep the flow of the presentation smooth. And feel free to add your questions into the chat so that we can read them later. And we'll attempt to address all questions before we conclude. So thanks for your patience. And again, thank you for joining us today. Next slide, please. So we have some administration staff announcements. One of our own, Nova Evans, has accepted the position of Director of Programs at headquarters. And Nova will be she has started her position on July 9th. She was previously the Deputy Director of Federal Programs. Joining Nova is another one of our own, Janet Furman, who has accepted the position of Deputy Director of Programs. She was previously the Director of Children and Family Services, and we're really excited about this dynamic duo and look forward to supporting their vision for the future. Rachel White, our Deputy Director of the Eastern Shore Regional Office, has accepted the Director's position and has some pretty big shoes to fill. Rachel has a wealth of experience and has had the privilege of working with her mentor, Kim Giselle. Oh my goodness, I never said her name correctly. I apologize. But we're really excited for the Eastern Shore Regional Office team and look forward to working with Rachel as our newest regional director. And another one of our own, Megan Hall, has accepted the position of LTSS Maryland Program Manager. She was the LTSS coordinator out of the Southern Maryland region, and we're really excited about how she will lead the team in this position, having a great focus on supporting all of our program managers to operationalize our future changes and enhancements to our system. If we can have the next slide, please. We're excited, we're pleased to have with us today Kelly Marie Smith. She is our basic assurance reviewer. She'll be sharing some of the examples of positive impact on the CQL, the Council of Quality and Leadership and basic assurance reviews, and the personal outcome measures, which we call POMs, right? So they were doing interviews for those with the collaboration of CCSs. So her presentation is going to highlight how these processes contribute to enhancing quality and person-centered outcomes. So without further ado, Kelly, if we could share the next screen, and Kelly, you have the mic. Welcome.
Thank you, Nicolette. Good morning. Thank you all for having me today. My name is Kelly Marie Smith, and I'm a senior quality reviewer with Liberty Healthcare. And I've had the opportunity to participate in the personal outcome measures tool. We do it in conjunction with the basic assurance review, or we can do it alone as a POM. Wanted to share some examples with regards to the POM. As we travel throughout the region, we've had the opportunity to speak with people and find out what is important to them with regards to their lives, their PCP goals, their desires, and their preferences. So, wanted to talk a little bit about, wanted to give some examples of some success stories with regards to the personal outcome measures tool that me and my colleagues have noticed as we travel throughout the region. So for some context, the person and their CCS were interviewed for the personal outcome measures. As the interview discuss choice in the person's life, the person indicated that they need more support for community integration. Currently, they are only funded for follow-along services. As the reviewer dug in a bit deeper into how they define community integration, the person mentioned that they would prefer to have personal supports to go into the community more, to become more independent, and stated they did not want to attend a day program. The person wanted to focus on making connections and building relationships that they define outside of the current PCP that states working and spending time with family. The person was able to define what outcomes they wanted, such as obtaining a driver's license, and supports they did not want, such as attending a day program. While the reviewer completed the CCS summary, while the reviewer completed the CCS interview, the CCS stated what she thought the person's goals were, but she did not realize the priorities of the person had for discovering their own outcome. Example, driver's license. The CCS stated that she did not realize what he was asking for and what he was looking for. When the CCS POM summary was when the CCS summary was received, the reviewer was able to provide good reflection of the person's goals and desires. The CCS shared with the reviewer that the report will help them align services with the person's identified outcomes and will provide better support for the person-centered planning. The CCS plans to use the summary report to call a revision meeting to look at different service options to support the person to be more integrated and have increased access to their community to further promote independence. They plan to review the report and revise the person's plan around seeking more community support outside of working hours. The CCS told the reviewer that the POM was helpful in gathering information and identifying the areas that the person prioritized. So that is just one example as we conduct the POMs. um, as we have conversations with people, there's information that sometimes the CCS is not aware of, then we are able to gather and share that information with the CCS so that they can use it during the preparation of developing their person-centered planning goal. And I had two other examples I would like to offer just to give some more experiences that I shared. I'm sorry, that I've had conducting the POM. So I met with a person supported. She was currently receiving personal supports. But as I continued to have POM conversations with her, it was discovered that she had a desire to work, and the person knew exactly where she wanted to work. She was interested in working at Giant Food in the floral department. And the reason why she wanted to work there, her father was a former employee of Giant, so she had relationships with that store, and she also had a interest in horticulture and flowers. So the person also identified two other areas of interest with regards to working. She was interested in working at an animal shelter or working in a bridal shop because she loved picking out formal gowns and dresses. And when we looked at personal goals, the person was able to share that she would like to take a dance class at the community college. She was interested in um, tap and jazz. She also was interested in taking a math class at CCBC Essex campus. She shared that she loved to swim, and the YMCA in Towson was in her community, and that was something that she was thinking about doing. And lastly, she was interested in taking a crafts class, possibly at Michael's craft store. So it was perfect timing that I met with this person because her CCS was promoted and she was about to start working with a new CCS. So I was able to gather uh, a lot of valuable information and forward that to the CCS. And it was my hopes that it would help open up conversation. And she gave a lot of detail, and she talked about her preferences. So it was my hope that the CCS summary would help the new CCS develop a great rapport with her and to know exactly what her desires were. And lastly, I wanted to share um, this example with regards to a CCS summary that I completed. Most times when we do the POMs, we also talk to the staff that knows the person best. And in talking to the staff that knows the person best, they were able to share some information about the activities that the person liked to perform. So this person was really interested in different types of transportation. He enjoyed going on car rides. He enjoyed riding on uh, the subway, but we wanted to just explore how we could make this goal or possible outcome more um, purposeful. So when we started talking, we we thought about some of the different places the person could possibly visit, and this was the suggested uh, outcome that I shared in the person. I'm a little over in the CCS summary report. So because the person enjoyed various types of
Welcome to the
mobile
webinar. You
communication.
for that.
Um, we suggested that looking at making the person's preferences um, more specific and not just going on rides. We have the B&O Railroad Museum. We have the Museum of Industry that are right here in Baltimore. We have the Air and Space Museum in and Washington, D.C. So we started just looking at some of the different venues around in our area just to make this more fun for the person, not just going for the car rides. So those are a couple of the examples I wanted to give to just share that as we travel throughout the region, people are advocating for themselves. They know what they want, and it's been a great experience just going around meeting with people supported and hearing their voice and hearing their preferences and sharing that information with the CCS through the CCS summary report. Thank you.
Thank you, Christina. I mean, Kelly. Whew, sorry, I keep switching you with those K's and C's. Does anybody have any questions? This would be the time where we can ask Liberty questions. It's the only the time where we will take questions during this presentation. All right. All right. Well, wait, I see Rosemary has her hand up. Let me, Christina, if we can unmute Rosemary. I am not able to. Enable mic. All right, Rosemary, it's coming. All right.
There we go.
There you go.
You there?
I am. Thank
Can
you.
you hear me?
Yep.
Oh, good. So my question was, I'm wondering if DDA or Liberty could share those things that Kimberly, right? Kimberly just talked about. Could we see those on the actual CCS summary that she was referring to?
Kelly, could you and your team draft something up like this, and then we could share it with our coordination of community service agents?
Definitely, that's something that we can do.
Thank you. A lot of great work here. All right. Anyone else? Any other questions? All right. Christina, if we can go back to, well, thank you, Kelly. Really appreciate your time. Thanks for coming today. And once we get those summaries together, we will be sure to send them out to the CCS agencies and leadership. Thanks for
So,
your time.
you're welcome. Sorry, Nicola. Just wanted to interject. So we have started sending out the CCS summaries as we complete the POMs, but I will definitely make sure that I share that information so that all of the CCS agencies can have that tool.
Thanks. You're getting some hearts. Much
Thank you.
appreciated. Very much
Thank
so.
you. You're welcome. Appreciate you. Thank you for everybody's time.
Thank you. So it bears repeating. This is the slide 11 that I was discussing. Again, we brought this up in April, and we know that just part of today's world, you might use your word processors to take notes when you're out completing comprehensive assessments. And then later, a coordinator might just copy and paste it into the LTSS Maryland platform, right? But while this approach could be efficient, it does leave room for error, which we have seen. Even what may seem like a minor mistake could constitute a HIPAA violation. So it's really critical to double check your work before you're submitting it. Please, please double check you're saving it and then you're submitting it. Please review what's being entered in these comprehensive assessments because they cannot be edited after they're submitted. And again, if there's information about others accidentally, right, you're copying and pasting, maybe it didn't copy, whatever have you, please make sure you're double checking it before hitting submit. Again, this would be a HIPAA violation since this section cannot be edited and other people's information would go into another's profile. Next slide, please. We are welcoming Ama. Oh, yeah, wonderful. Ama, thanks for coming today. Appreciate your patience. Go ahead and take it from here.
Thank you for having me, and good morning, everyone. First, we want to talk about the Medicaid waiver eligibility. We continue to see waiver packets that are initiated prior to waive placement, which is not in alignment with established procedures. As outlined in the communication that was sent on December 16th, 2024, individuals who are denied enrollment or disenrolled from any DDA-operated Medicaid waiver program must first be added to a waive in LTSS Maryland before they can reapply. A new waiver application cannot be submitted by the Coordinator of Community Services unless the individual has been added to a waive in LTSS Maryland. CCSs should contact the DDA regional office if an individual wishes to reapply for the DDA waiver program, or if an individual has been globally deactivated and requests to be reactivated. Next slide, please. According to the concurrent eligibility process timeline, person-centered plans and DDA waiver application package should be submitted within 30 to 45 business days of waive placement. However, there are currently approximately 500 applications that are not meeting the required timeline. Below is a high-level overview of the expected timeframes for the concurrent eligibility process. Additional training and resources are available on the DDA website. So for the concurrent eligibility process timeline, the medical assistant or MA waiver application must be signed and submitted within 3 business days of the applicant being placed on the waive. The initial person-centered plan must be submitted within 10 business days of the waive placement date, and the DDA waiver application packet must be submitted within 2 business days of the PCP being authorized or approved. Timely submission of these components are critical to ensure that individuals do receive appropriate services without delay. Next slide, please. We have encountered several cases where individuals should be disenrolled from the DDA waiver program, but DDA was not notified of their current circumstances. The notification authorization to participate, or ATP, is the only type of authorization to participate that a CCS creates in LTSS Maryland. This notification ATP is submitted by the CCS to inform DDA regional office that an individual currently enrolled in the DDA waiver program has experienced one of the following changes. The person is deceased, has been admitted to a long-term care facility, has moved out of state, has declined waiver services, or is no longer receiving DDA services. Upon receiving a notification ATP in LTSS Maryland, DDA regional office staff will verify the information. Once that information is confirmed, they will submit a disenrollment ATP to EDD to complete the disenrollment process. Next slide, please. And now we're going to talk about the Medicaid redetermination. Medicaid checks eligibility every 12 months, including income and assets. To continue receiving Medicaid and DDA waiver services, individuals must complete a renewal or redetermination process when notified. Notices may come from the Eligibility Determination Division, the local Department of Social Services, or the Maryland Health Benefit Exchange. So we are encouraging CCSs to encourage individuals and their families to respond to renewal notices immediately. Delays or no response may lead to loss of eligibility or Medicaid. Next slide, please. What should CCSs do? The coordinator of community services should stay informed of each person's Medicaid status and renewal cycles. If an individual receives a redetermination notice, to work with them, assist with completing and submitting the redet document, and ensure that contact information is up to date. Next slide, please. Here are some helpful reminders. Notices typically arrive 60 days before the due date. Individuals may receive notices even after initial waiver approval. Coordinators of community services should encourage individuals to check their mail and emails frequently, log into MyMD Think, call the DSS, local Department of Social Services, at the number listed, or visit in person, or contact you, the coordinator of community services, if they are unsure of any information. Next slide, please. If a renewal or redetermination deadline is missed, individuals have 120 days or 4 months to submit a signed redetermination packet. There's no Medicaid coverage during this period. If the individual is found eligible, coverage may be reinstated. If they are found not eligible, a new waiver application is required. Again, based on the December 16, 2024 memo, please reach out to the regional office prior to starting a new application. CCSs can track due dates and follow up proactively, also educate families about consequences of delays, and also coordinate with the regional offices as needed. Next slide, please. Thank you all. If you have any questions, please do not hesitate to reach out. Over to you, Nicolette.
Thank you. Thank you. All right. Let's talk person-centered planning. So, as per the person-centered plan policy, revised PCP should not occur within the 90-day annual plan date as the development of the annual plan has begun. If there is a significant issue or change in the participant's needs during this planning period or any other time during the planning year, such as when a participant requires employment services for starting a job, supports needed after they are coming out of surgery, or let's say the participant was relocated to a new site, and we'll get into that relocation process later where this is applicable. The coordinator of community services must select urgent under the plan details so that the plan is to be reviewed within the next 10 business days. We'll show you what this looks like in the next slide. But just as another reminder, after you're selecting this urgent, for these urgent situations, the CCS should also reach out to the plan reviewers to alert them that the plan is coming and it's marked as urgent. So if we could go to the next slide. This is the example, right? So under plan type, where the CCS would select urgent. So it's highlighted red with red arrows. You see it says urgent, but please note that the reason for revision when you're entering it is clear as to what the urgency is and what the new supports are being requested. Right, so you're selecting urgent, and then in the details here, you're clearly saying what the urgency is and what is that new service so that the reviewer can go right to it. Next slide. It bears repeating, right? As per the person-centered plan policy, urgent must not be selected due to a late person-centered plan submission, right? We want to make sure that this is for urgent situations, as the person is requiring new services. The regional reviewers are going to continue prioritizing these urgent plans. All right, next slide, please. All right. As we're talking in a lot of our meetings, whether it's with me, with your leads, the CCS teams, we do understand that some of your delays in this person-centered plan timely submission or any of these clarifications are around the provider's role and responsibilities. But first and foremost, we want to acknowledge the incredible efforts many of you have made in building these strong relationships with providers. These connections have supported the development of timely and comprehensive person-centered plans. Building a rapport strengthens the teams, and strong teams are essential to ensuring consistent, high-quality services for the people they serve. So it's equally important to know who you're working with, right? Providers vary in their responsiveness, their availability, and approach to the planning process. But as the facilitator of the person-centered plan, it's the CCS's responsibility to anticipate where reminders and follow-up or clearer guidance might be needed. So if you know a provider is typically late in submitting documentation or confirming participation, consider reaching out earlier than usual. This proactive communication helps avoid last-minute delays and supports a smoother planning process for the participant. We understand that a reason for the person-centered plan submission delays and clarifications are around these roles and responsibilities. So as a PCP facilitator, we want to provide you some of the tools that you can reference, such as the DDA provider's role in the PCP process sheet during pre-planning. You could use it to remind each provider of their specific deliverables. And for those who tend to run late, sending an earlier nudge tied to the deadlines above, right? So those proactive reminders, again, protect that timeline, keep the person's plan from going into auto extend. Next slide. And as taken from the DDA provider role in the person-centered plan process document that I referenced, collaboration is key. This is linked in this document. I'm giving you all a second to just read that. If we can go to the next slide. So to further support this team collaboration, here are a few reminders of the CCS's role to support the timely completion of the service implementation plan. As taken from the SIP policy, the service implementation plan policy, at least 10 business days before the annual person-centered plan meeting, you want to review the participants' chosen outcomes with the provider. This helps them develop the SIP before they have to hand it back to you 5 days before the annual plan meeting with the person. You're discussing the person's needs with the selected provider to inform the service implementation plan, as I said. You want to talk about the chosen goals tied to the PCP outcome, the number and frequency of services needed, right? The units needed as per the DSAT when available, the detailed service authorization tool. And what is the person's learning styles, their motivators, their environmental sensory needs, personal preferences, etc. This way, when it comes back for review for the participants' agreement in how their services are going to be provided, it helps ensure a smooth process, right? The okay, it doesn't have to keep going back and forth. It's possible it will if the person disagrees, but that is why there's timelines established by the DDA in this provider document. Next slide. And just a couple extra ones, right? You want to review the SIP and the service details with the person and or their authorized representative. You want to communicate those requested changes to providers or support staff, right? So as I just said, you're reviewing it so that the person understands what the implementation plan is, and any adjustments that are needed or any disagreements, you're working back with that provider and discussing it to update that SIP. And then, of course, you're uploading it into the person-centered plan. Next slide, please. We're going to talk about monitoring and follow-up and timely form submission. We talk a lot about barriers, again, in our meetings, right? And we understand that one of the barriers is when you're unable to complete an in-person monitoring and follow-up meeting because the participant's been out of the state or the country for 3 months or more. Please document this in the monitoring and follow-up form on the other section. You could also add it into the CCS activity notes, but adding it into the other section will keep it documented on the form as it applies to that month and why. Within the quarterly generated form, you're going to select, was the participant contacted successfully? You'll select no, because the monitoring could not be completed. You'll enter the description, and then the supervisors, of course, should follow up with their regional office CCS liaison to report the barrier, as we've been doing, and any further barriers moving forward. You know, for example, are they continuing to be out? And our regional office liaisons, your CCS liaisons, will further support this and these challenges. Next slide. Now we're going to talk about monitoring and follow-up visits for quality. You want to ensure the correct service is selected to indicate that that was the service that was observed in person. So if it was, you know how you could select, yes, the service was observed in person, you only want to select that one if that was the only service observed in person. In order to document how the other services were assessed, right, for that quarter, you must include all of the considerations and confirmation sources in the open box. So the next slide is going to show you, after you select, was the service monitored in person? It's a no. In the other information sources, I don't have my glasses today. That's where you're putting in those details, right? So we have a little example here. Oh my goodness, my eyes. How was it obtained? Was it, you know, through conversation? What was asked? What documents were reviewed? And so forth. And don't forget to save services to the table afterwards, and then you're submitting it. Next slide. As we're working with Liberty, another monitoring and follow-up quality improvement that we would like to share is including the detail on the progress towards outcomes. So again, utilize the considerations and confirmation sources found in the monitoring follow-up guidelines posted on our CCS website. And as the CCS is assessing progress, asking these questions and reviewing these documents will support a thorough understanding of the person's progress towards their outcomes, and thus you can complete the monitoring and follow-up form with more details. I'm going to give you some examples of what a good detail looks like versus some of those that we've been seeing that would not meet this detailed progress that Liberty is looking for. Right? So you're looking at what did the community integration look like? What were the new activities they were starting, right? Depending on the person and what the situation is. Did you see environmental modifications made as they were requested, right? If that was the service and that was an in-person. Next slide. So here's an example of progress towards outcomes being met, right? So what makes this look good? How was the information found? We're seeing, it was the mother informing, it was in person. They saw the community integration in progress as they joined their peers to bowl. It included the activities they participated in and where. So it was really good detail in this one. Next slide. Here's another one of progress towards outcomes being met, right? What were the new activities they're participating in? What did they enjoy? The person was reporting it, right? The mothers, depending on what is stated in the person-centered plan, right? Again, it's saying what's going on with the finances. How are they learning about it, right? So they're going to the YMC gym, they're swimming daily. There's even the frequency there. All right. Next slide. Now let's talk about a couple examples of what would be unmet. And as you see here, there's no content. There's simply yes, yes, yes. We don't want that, right? We want to actually explain how progress is being met. Next slide. Again, in this one, while you might see a little bit more words, they're generic statements. And we don't want generic statements. Again, as we talk about person-centered planning, we want this form to be completed as the person, right? You're taking it, you're seeing it, and you're completing it as like a person-centered approach. So they're working towards the progress. This is generic. It doesn't say anything about how the person's meeting their outcomes or the progress, what it's looking like. And then if we can go to the next slide, this one was not met, but it was close. Why not? There's no details on the types of activities, right? It says I attend different activities in the community. Well, that's great. What activities? Did they go to the nail salon? Did they go bowling? Did they go to a billard? Did they go shopping? And then additionally, this was the same progress that was noted on the previous quarter in this example, and there was no new updates. So as you're seeing that, it's important to know where the person started, right? Especially like, let's say it began with hands-on learning and now they're verbally prompted, right? That's progress, especially if they're learning how to make their bed independently. All right, next slide. And a good segue, as we're talking about monitoring and follow-up, you know that during this, you're looking to update any demographic information, right? Has anything changed demographically? You're looking into that during your quarter, and then you're updating the demographic section. So with all that being said, we wanted to make sure you were aware of what the symbols mean next to the addresses within the client profile section of LTSS Maryland. This came out last year, but we wanted to make sure that you knew that the green check mark means that that address was validated in the system. If it was a red exclamation mark, that means it was non-validated. So this, as we're utilizing this information right across the board, we're creating letters, we're sending it out. If it's not validated, it's going to come back and the person isn't going to get a letter that they need on behalf of DDA. And another thing, we really wanted to make sure that if an address is no longer in use, right, make sure to uncheck current address, mailing address, and or the permanent address. So just ensuring if it does have a red exclamation mark, you know that they're not utilizing that anymore. Make sure you uncheck all of those things because it could cause issues and again, go out to the wrong address. All right. Next slide. Policy and program updates. And we go to one more slide. We are going to hand this off to Nova, our Director of Programs, to talk about the DDA-operated Medicaid waiver program amendments. Nova.
Hi, Nicolette. Can you hear me?
Yes, and thank you so much for joining us today.
Okay, great. So just a couple updates about the Medicaid waiver amendment. The submission to Center for Medicare and Medicaid Services will be on July 17th. We had the public comment period between June 9th and July 8th, and then we extended that comment period for respite and supported living because there were challenges uploading those documents, so that period was extended. So it is closed now. The next steps will be that we got over 400 comments from people all over, stakeholders, in regard to the waiver amendment. So we're sorting through that now. We want to make sure we capture every single comment to be included. We'll be writing a summary of those comments that we'll be posting on the website so everyone can have that information. And it'll talk about what the comment was and what DDA's stance is on that. Was it accepted? Was it not? Did we make additional amendments? So we'll be making some adjustments based on stakeholder feedback. And then, like I said, we'll be submitting the actual amendment to CMS on July 17th. We will also have continued conversations with CMS related to that and follow-up questions that they have over the next several weeks, several months. We'll be also providing updated appendices based on that stakeholder feedback on our website. So there'll be a lot of information coming soon related to that. And we'll also be putting together all the changes that we'll be making specifically with CCSs. We'll be providing training, information, updates as we kind of move through that process and what to expect. We anticipate the amendment effective date October 6th, 2025. At this point, you can find all the information we have up on our website, and I think that second link is probably where you can find the information. It'll show you the appendices as we initially proposed, and then what they look like with stakeholder feedback will be getting up there by the 17th. You can also find all of our webinars that we conducted. We conducted 4 webinars, and then there was some stakeholder engagement that will be posted there. You can find that. And then you can also find our waiver FAQ. We got a lot of questions, so that's up there. It's very comprehensive if you have additional questions. And then finally, we also posted the CMS technical guide, which guides us in how we write the waiver and what our requirements are. And then there's a little video on that. I'm sorry, it's not a video, it's a PowerPoint presentation from CMS kind of talking through the new technical guide, which is updated in 2024. So that's where we are, that's the next steps. And like I said, we'll be providing updated information and training as we kind of go through that process.
Thank you, Nova. And if the community of practice, the CCS, wants to put together some questions that you have so that we can utilize and incorporate into the CCS training before this goes live, that would be helpful. We'll further talk a little bit more about that so that we can get you the information that you need. Next slide. Now we're going to be welcoming Nicole Keener. She's going to be talking about the transitioning forensically involved individuals process with the regional offices. Nicole, thank you.
Hello. Oh, I don't know why my background isn't there. So in order to have smoother transitions with discharges from any of the facilities currently, I am acting as the liaison statewide. So it doesn't matter if the person's in any of the other regions. I'm going to be your contact. We're requesting that you reach out to myself prior to doing any type of referrals to agencies, as we've had a couple bounce back quickly while they were inappropriately placed with an agency that wasn't equipped to handle their forensic involvement, and they weren't knowledgeable about forensics. With all of the information that we have on our individuals, we can help to streamline and make sure that we are doing referrals to the best providers for them. So like I said, I'll be your main contact and my email is there. That's the best way to reach me. Reach out when you have somebody you're going to start doing referrals for, and we can talk about it and make sure that we are doing the appropriate ones. That includes Set and Potomac Center. I know they have Sean and Jess there, but this is just an additional, checks and balance to make sure we are placing our individuals somewhere that they can be successful. Same with any forensic questions. I'm always available if you have any. I think that's all I needed to cover.
Alrighty, thank you so much, Nicole. If we could go to the next slide. Again, this is talking about why it matters, right? Streamlining, preventing reentry into restrictive settings, and just overall supporting successful transitions into the community. All right. And before we get to the next slide, we have a special guest with us today. We have Nick Quiñeres. Nick, you're going to have to correct me on that. But then I really apologize if I butchered it. But Nick is going to go over some LTSS updates that are coming through. He put some things together. He'll also be speaking on them at the community meeting for you to see visually. It'll be there. But Nick is here to talk a little bit on some of the LTSS updates that you should be aware of. It doesn't hurt to get it across a couple of times, right? So Nick, if you could unmute yourself and go right ahead. That's all right. Okay. I think something happened. Let's get to the next slide. We're going to talk about the participant relocation. It's a new DDA, new relocation process. As per COMAR 10220205A, Developmental Disabilities Administration must be notified by the traditional providers of any site opening, closing, relocations at least 30 days prior to making the change. That's the provider's requirement, right? Effective July 1st, 14 days ago, the DDA implemented a new process for the traditional providers to notify the regional office of any new relocations, planned or emergency purposes. So please review this new guidance so that you're familiar with it as well. They're going to be submitting it via a form, but just so you know those situations in which this applies to. What's really important for you to know is that your person-centered plan process remains the same. If someone is relocated, right, whether it's planned because the person wanted to within 30 days, you're completing that within 30 days for urgent situation, right, or emergency. You're completing the person-centered plan, the revised with the urgent button. And it would be in some of these circumstances. However, as per PORI, additionally, monitoring and follow up. If someone's relocated due to health and safety, please immediately follow up with the person, submitting an incident report as needed. So it's really important, especially if they're relocated, right? Health and safety is ensure of. You're making sure that they had a choice, right? We're looking at the CSQ within 30 days if they're moved. So all of those requirements still apply as the CCS. Another important note for you to also be aware of is that DDA is not permitting traditional providers to use any Airbnbs for DDA-funded participants to reside in for any purpose. Next slide, please. All right, here's our resources and other related activities. Since Marianne's out, you know that she has been reviewing our DDA webpage, all of the resources and related activities there for families. Also great for you to have. And today we're going to be focusing on social and spiritual opportunities because it's essential for people with intellectual and developmental disabilities. These experiences support a sense of belonging, connection, personal identity, meaningful relationships, community involvement. They contribute to emotional well-being. So while participation in spiritual practices can offer comfort, purpose, and a shared sense of values, it's important for everybody, right? So ensuring these inclusive access to these opportunities helps affirm each person's dignity and supports a fuller, more self-directed life. So you can find these and other helpful resources on our website, as we mentioned. Please explore them. The more you're familiar with them, it's easier to, in your conversation with people, bringing them up. And if you know of any statewide resources that we haven't listed on our page, please share them with us. Send them over to Marianne, and we would love to include them on our website. All right, next. And of course, the social spirituality can go under the FAE section, by the way, of the person-centered plan. So any of those recommendations, resources, whether it's in your monitoring follow-up, goes right into the person-centered plan as well under the FAE. This is a little bit of an update. So if you haven't seen it yet, the marylandbenefits.gov has changed their name. It was My MD Think. Again, this is a mobile-friendly and plain language application. People are able to complete it in under 30 minutes. It has the benefits for which they might be eligible for. It's listed there. Also helpful for you as you're supporting people to know that. And the customer portal will remain the same. It's just the name update, right? And they've enhanced the mobile application process. Customers, participants can still apply for their benefits on here. But as of June 27th, that URL for the mymdthink.maryland.gov will automatically redirect to the new marylandbenefits.gov. So it'll ensure customers can continue to access benefits, right? Whether or not they use the new or old URL, it's helping it be more streamlined and user-friendly. Next slide. Stephanie unfortunately had to step out at 11, but this is a community celebration. Tell people that are interested. It's great. It's talking about Maryland Inclusive Housing, right? They launched as a nonprofit organization. We support them, the Maryland Developmental Disabilities Administration, and it is intended to become Maryland's leader in helping Marylanders with IDD successfully access and maintain inclusive, affordable housing. In 5 years, MIH has done exactly that. They've helped find affordable housing for nearly 50 Marylanders with IDD, and they're living richer, fuller lives independently. But since we haven't been able to do it alone, MIH, DDA, you have also been a part of that. We want to celebrate that. So if you can, please attend the 5th anniversary celebration. It'll be on Tuesday, September 9th. Admission's free. There is going to be an open bar. Not open bar, I'm sorry. Fun food, but admission is free. I know. So please just join the brewery. I know everybody would attend for that, right? Putting it on our calendars, but no, really, let's raise a glass together, toast to the memories we've created, helped people out. Thank you for all of the work that you've been doing too. So let's get people in their homes independently and in the community. So thank you. All right. And this went out through Constant Contact too, by the way, if you wanted to refer to it. Okay. Reminders. So Stephanie wanted to talk about the Talk Tech webinar series that continued. There was one on July 9th. There's one tomorrow, specifically for coordinators of community services. Lotus is a new technology to assist people with limited mobility operate electronic devices in their home and when traveling. So tomorrow, Daphne Stefan will walk you through how to use the AT Navigator, the Assistive Technology Navigator, during your planning with participants and their families. It should have gone. It was through Constant Contact. If you need that registration, please reach out to our professional development team or Stephanie Jones. If you're not sure, feel free to email me and I'll get you that link. We are a technology first state, and we really want to bring all of these different opportunities so that you can learn more about what's out there. Technology is moving fast, and we're trying our best to keep up with it, and this is a means of informing what else is out there, right? And how to help this conversation with participants. All right. Before I get to our closing, I saw Nick laugh at me. If Nick, you're available to unmute yourself, let me know if you can't. And you want to go over some of those LTSS updates, upcoming updates that will CCSs should be aware of. Where are you? There you are.
Hey, everybody, can you hear me?
Thank you. Yes, we could hear you.
All right, perfect. Nicolette, did you want me to just talk through it or you want me to share that document I had put together?
Yeah, I think sharing it would be great. I know we'll have it on our community meeting as well, and we can share it with our CCS community after this as well. Everybody apologize. Nick messaged me and I was like, yes, great opportunity. Would love to have you to talk on this. So thank you, Nick. Feel free to share your
so
screen.
it's saying I can't present because I'm not the presenter. If you're the one presenting, if you want to pull it up, you can, or you can, it says you have to make me a presenter for me to present.
All right, done.
All right, let's see here. Hopefully you should be able to see it now, right?
Yep, looks good.
Great. All right, so good morning / almost afternoon, everybody. Just going to talk to you about some of the LTSS Maryland updates that we have either just recently made or are in flight right now. So for each of the projects, I'll kind of talk about, quick summary of what it's about and when it's releasing. So the first thing is we did have an LTSS Maryland release this past weekend. There were a couple of updates that went out. The first is we did some updates to our DDA eligibility letters. These are the letters that are generated by DDA-HQ and the regional offices. There were just some minor updates to the letters themselves, putting some content in more like plain language so it's easier to understand, updating some of the enclosures that go along with those letters. So that was the first update that went out this past weekend. The other one is more on the DDA regional office side, not directly impacting the CCS user groups, but I'll just kind of quickly touch on it. We did some updated business rules that relate to the DDA waitlist and waves and how it connects to the overall decision form that's done by EDD. This included a series of updates, but ultimately it was putting in updated logic on how individuals get classified as either active or inactive on the waitlist based on actions taken within their record. We did some updates to some of the DDA global deactivation rules to make sure that we were properly triggering global deactivation based on the reasons selected in that overall decision form, and updating information that it displays properly within the client summary page in that DDA waitlist and global deactivation section when certain events are triggered. So that was the other update that went out this past weekend. Now, for our next release, which is happening on August 11th, we've got an update that's going out that is more for the regional offices, but it will impact CCS users. So what we are going to allow DDA regional offices to start doing is if there is a PCP that is, for lack of a better word, stuck with the CCS in clarification request or consult requested, and they've determined that it's been there for too long, rather than them having to wait for you all to submit it back up to them, we're going to allow regional offices to decision or deny a plan that is stuck with the CCS. So that's one new function that's going to be available to them. Another thing that we're going to allow the regional offices to start doing is end dating services that exist within an auto extended PCP. So they already have the ability to end date an entire PCP, but now when it comes to auto extends, we're bringing that down at the service level to where they can end date individual services if they are no longer needed. And then the third component of that enhancement that's going out in August actually does benefit the CCS users, which is related to the revise functionality. Right now, you all are not able to revise a PCP that is no longer active. So for example, let's say services ended for whatever reason and you wanted to do a revision, the system's currently forcing you to start a whole new plan rather than copying information over from the most recently active one. So we are modifying that rule. So you will now, starting in August, be able to revise PCPs, the most recently active one, even if it's not active anymore, you'll be able to revise that one in order to turn it into, let's say, an annual plan or a revised plan rather than having to either start from scratch or starting with an initial. The next update, which is also going out in August, this again is more on the DDA provider billing side related to our non-EVV services, but we're implementing a new project that's going to allow for the resubmission of non-EVV services anytime there's like a PCP or eligibility correction. What's happening right now is when there are PCP or eligibility corrections and LTSS Maryland and Provider Portal go to rebill those previously disapproved claims, the system is flagging those as duplicates, even though they're not duplicates. So we are correcting an issue in the logic so that when those corrections are made, the payments can be rebilled without being flagged as a duplicate when they are not. This next one, also for August, this is a big one. This one will impact the CCS users as well as DDA HQ and the regional offices. So within the client attachments category of LTSS Maryland, you all, as you know, already have access to some categories, but we are creating some brand new DDA specific client attachment categories so that when you have DDA specific information, you can upload it to the specific area. So there will be 4 new, excuse me, client attachment categories. There will be DDA application, DDA archive, DDA forensic, and DDA letters. I've listed out here which user groups will be able to upload and delete versus just view. So as CCS users, you will be getting access to the DDA application category and you'll get full access. So you can upload there, view documents that are there and delete ones that your organization has uploaded. You will not get access to the archive or forensic categories because that's specifically something that DDA-HQ and regional office is using in-house. But you will also get access to the DDA letters category specifically for viewing because it will be HQ and regional offices that will upload that content, but you will have view access to it. So that's another thing that's coming out in the August release. Next, we'll move on to looking forward to our September release. So the first item going into our September release is for allowing retroactive editing of residential services to remove or add overnight supports. This is specifically for our regional office staff, so not directly for the CCSs, but this is going to be a way for the regional offices to make updates and adjust and backdate effective dates for overnight supports. So that those can be resubmitted through the provider portal system for billing and payment. Next item for our September release is again going back to client attachments. So right now there are some client attachment categories that relate to EDD, and technically there are 3. But what we recently discovered is that you all as CCS users only have access to 2 of those 3 categories, which was an oversight. So there are 3 categories. There's applications, financial documents, and redetermination applications. But you all as CCS users don't currently have access to redetermination application category, so we are fixing that. So starting in September, you'll get access to that additional category where you can upload relevant redetermination applications specifically there, rather than having to put them in the application category, which is supposed to be used for initial applications. This next one is a big one. It impacts everybody. So in the last couple of weeks, we've been doing some investigation based on some data analysis that we've done. And we've identified that there's a flaw in how LTSS Maryland is identifying pending applicants for CS, FS, and CP. So as you all are aware, within the client summary page of LTSS Maryland in that program snapshot section, that's where you can look up information on what programs the person has applied for and whether or not they're still pending or denied or approved or disenrolled. But what we're finding via reports is that we're seeing individuals being classified as pending applicants when they shouldn't be. So we did some looking into how the system was making that determination and identified that we needed to do some updates to the logic. So that's what this is going to be about. So the new logic for how we will identify somebody as a pending applicant for one of these 3 waivers is by looking to see if there is a DDA waiver application present for that individual that has been started, where the MA application has been uploaded within it. So that will be the new logic starting in September. And when we put that in, it will fully correct all existing data as well as apply going forward, of course. And this would not only be for initial applications, but for reapplications as well. So for example, if somebody applied, and let's say they got denied via the overall decision form, and then a new DDA waiver application packet came in where the MA application was uploaded, the system would recognize that even though the person was denied, new application went in, so we would flip their status back to pending. Right, continuing on, let's see here, skip that one for now. There's a couple that I'm going to skip for now because I'm still working on the write-ups, and we'll talk about those more at the community meeting. So let me just focus on the ones that are more important. Okay, another one here, this one, the release date on this one's a little bit out. It's not until February of next year, but we will be converting the DDA shared living service to a daily service. So for shared living levels 1, 2, and 3, the reason we're doing this is right now those services default to the last day of the month when they're billed, and that's creating billing payments because let's say the individual passed away or was disenrolled during the middle of the month. Because it goes to bill on the last day of the month, that is causing payments not to go through. So the decision was made that we are going to be updating the way that this service itself is implemented and built to the system to be a daily service. So this is a project we are just getting started with our software development, with our software developer. So this one's in its early phases, so I will continue to provide updates on how this one progresses during these monthly meetings. This is another one that I do not have a release date on yet because we have not signed the work authorization, but one that we are in the early phases of. We're just starting this one off, but we're going to be doing some updates to the personal supports service within the CP person-centered plan. We're going to allow you all to start breaking. So when you add personal supports to the plan, we're going to provide the ability to where you can break down the hours into daytime hours and nighttime. So for example, let's say you're requesting 8 hours of personal supports per day for your individual. You'll be able to have subfields that say, okay, of these 8 hours, they need 4 during the day and 4 during the night. During this initial phase, this is going to be purely informational. We're just gathering data. It's not going to change how billing works or force them within those hours. It's just about collecting data. So again, still in the early phases with this one, but this is one that we're getting ready to start as well. And those are the primary ones that I wanted to give updates on today.
Nick, thank you so much for that breakdown. Really appreciate it. Again, everybody, if you're signed up for our community meeting this week, we'll be reviewing it again. Does anybody have any questions? All right. Thanks again, Nick. Appreciate it. All right. And now for the closing. If we go one more slide. Wanted to let you all know at our next meeting, that's set for August 19th, 2025. We're going to be holding a micro training on person-centered plan writing and requesting services. We would love to have CCSs attend this. Please include anybody, within your agencies who would like to learn more about this. We're hearing from you. We also know internally that this is an area that we want to focus a little bit more on and provide that opportunity to give you more information. Stephanie and I are working on it. We've gotten some suggestions from you all about what to focus on, enhance, when someone has enhanced needs, right, and they live independently in the community for one, how to write a detailed person-centered plan, right, and how to look at those services and make those assessments for that justification, right, so that we can ensure a robust person-centered plan. That's a throwback for some of you. So please know ahead of time we're working on it. Please reach out if you want to provide some suggestions. And we're really looking forward to this. So put it on your calendars, please. Any other agenda topics? If you want to present on behalf of your agency's accomplishments, anything, reach out to me and also Carol Bowman, in case that, of course, in my absence. On beginning July 31st, I wanted to let you all know that I'll be out beginning July 31st. I'll return August 18th, and I'll be coming back strong on August 19th to speak with you all. But while I'm out, please continue working with your regional office leads. They'll connect you with the appropriate team members and, of course, do the fabulous job that they've been doing all along. They'll catch me up upon my return. Okay. And now for questions. I saw a few of you have had it. I'm going to be tossing the mic over to Marissa to relay those questions, and we will do our best to answer them.
Nicolette, I see you've answered a few of them. Do you still want me to read them out loud so everyone can hear the answers?
Yeah, no problem.
Okay. Can registration be set as a series for 6 month or yearly?
Yeah, so thank you for that suggestion. It looks like the registration for our CCS webinars here have to be done for each one, like multiple times, right? You have to sign up for each separately. What's being asked is that they're being sent out as a series, so you don't have to do that. So I am putting in that suggestion, that request to avoid you having to sign up for each one. So that's streamlined, you add it to your calendars and it's there. So thank you for that suggestion. Next question.
How should CCS track redetermination dates when the dates are not listed anywhere? These days we do not even receive the letters. I don't know if Alma's still on. She did answer it. I can read her answer. Oh, there she is.
I'm here, Marissa. I can read it. So CCSs should check the letter section in LTSS Maryland regularly for any updates or requests related to redeterminations. They can also use the EVS system, which lists the redetermination due dates. Also, because notices might be sent directly to participants, from agencies such as the local Department of Social Services and EDD, or even the Maryland Health Benefit Exchange. CCSs should remind individuals and families to share any Medicaid related mail they receive with them. It will also be proactive if the CCSs ask during their monitoring visits if they've received any mail from the local health departments, EDD, or Maryland Health Benefit Exchange.
All right. Larissa asked us 4 questions, but I'll read them separately so I don't overwhelm you. Congrats to Megan Hall. Is there a new LTSS liaison for Southern Region?
I am not able to answer that at this time. I don't know if Onesta is here or Megan, but just follow up with the regional office or Megan to talk about what's going on there.
Is there still a plan for EDD to join one of DDA's monthly meetings?
I believe there's a plan in place to have a joint meeting. However, the final date hasn't been determined yet, so we're still working together to come up with something that works.
Is it still possible to make suggestions on reports that would be helpful to see in LTSS?
Absolutely. Absolutely. Yeah, let's get a little group together so that we have representation from many of the CCS agencies. Reach out to me if you're interested, and then I'll work with our LTSS team to get something moving there.
Could DDA develop a one-page guide about ATPs for CCSs to include when a CCS completes an ATP and when a CCS receives an ATP from DDA?
We can work together, Nicolette, on this, and we can provide information on the website or to you all.
I think this might have been for when Nicole was presenting, but I'm not exactly sure. The question's from Wendy Richardson. It says, if we are currently working on this, does the CCS still need to reach out to you? I don't know if we can unmute Wendy and she can let us know what that was about.
I will ask if you could reach out to Nicole. Yes. If you're looking for providers, what would benefit this is that they could find providers that could take in this participant. If you're working with your liaison at the office, just loop in Nicole. I know that she could offer suggestions and providers to streamline this and get the person in a placement that meets their needs most appropriately.
Kathy, are you able to unmute yourself? I saw your hand raised. Maybe not. All right. What is the time frame for the deny if the plan is in clarification?
So a policy will be released before the implementation of this new system function that'll address that.
Is functionality still slated for CCS to be signed into the system without having to upload a signature page?
Yes, a request has been made for that functionality.
That was the last question, but I do think Kathy was trying to talk. She sent me a message that she can't unmute herself. So is someone able to unmute her, Nicolette?
Yeah, I sent a request asked to unmute in the GoTo webinar, Kathy, for you. You should be able to.
Okay. Hi, all. I'm finally unmuted. To also answer the CCS about even if they're in process of working with someone about contacting Nicole, we also are trying to ensure that the conditions of release or probation are part of the risk section of the PCP and that the mitigating circumstances are beside all of those. That way, when Nicole meets with CFAP and the individual, if they have conditions of release, it's very clear what the courts expect of the individual and to help keep that individual on track so there's no bounce back into the system. We've had quite a few bounce backs from providers recently, and so we really need to make sure we're looking at providers who really do understand conditions of release or probation and can really work as a team, because the whole point is we have found someone in community placement. We don't need them to go back to a facility or back to a jail setting.
Thanks, Kathy.
There
All
aren't any
right.
more questions, Nicolette.
Thanks so much. All right, everybody. Well, I'll see some of you soon and in some of our meetings.